Everyone, this is Jan Lee, and along with Marites, we shall be emphasizing our topic assigned to us in our mini symposium in Science 65 Genetics under Dr. Saliflor R. Ferrer. The topic assigned to us was Ehlers-Danlos Syndrome, or usually other researchers in the field of medicine term this as EDS. Now, assigned to me is to give an overview of this syndrome, and Marites shall be discussing the 13 types of the EDS. Now, we proceed with understanding what is Ehlers-Danlos Syndrome, or EDS for short. Well, by definition, Ehlers-Danlos Syndrome, or EDS, is a group of inherited disorders that affect your connective tissues, primarily your skin, joints, and blood vessel walls. Connective tissue is a complex mixture of proteins and other substances that provide strength and elasticity to the underlying structures in your body. Well, as you observed in the image, EDS is actually targeting both the skin, the joints, and the blood vessel walls, which makes it that the person who have EDS has an elastic skin. And another that, people who have Ehlers-Danlos syndrome usually have overly flexible joints and stretchy fragile skin. This can become a problem if you have a wound that requires stitches because the skin often isn't strong enough to hold them. And a more severe form of disorder called a vascular Ehlers-Danlos syndrome can cause the walls of your blood vessels, intestines, or uterus to rupture because vascular Ehlers-Danlos syndrome can have serious potential complications in pregnancy that you may want to talk to a genetic counselor before starting a family. Now, we also have to try to understand the cause of Ehlers-Danlos syndrome, or why do we have this kind of syndrome, or how this syndrome starts and seemingly observable among humans. Now, the basic cause of this syndrome is that there are different types of Ehlers-Danlos syndrome that are associated with a variety of genetic causes, some of which are inherited and passed on from parent to child. Or if you have the most common form, hypermobile Ehlers-Danlos syndrome, there's a 50% chance that you'll pass on the gene to each of your children. So basically, it's inherited from parent to a child. So that's the only reason, or that's the only cause why EDS is observable in some certain situations, especially in humans. Now, we also try to digest the symptoms of this EDS, or the Ehlers-Danlos syndrome. Well, Ehlers-Danlos syndromes, there are different types of Ehlers-Danlos syndrome, but most common signs and symptoms include overly flexible joints. Because the connective tissue that holds joints together is looser, your joints can move far past the normal range of motion. So joint pain and dislocations are common. Secondly is the stretchy skin. Weakened connective tissue allows your skin to stretch much more than usual. Damaged skin often doesn't heal well. For example, the stitches used to close a wound often will tear out and leave a gaping scar, and these scars may look thin and crinkly. So, aside from these symptoms, we also have to include in our understanding about its complications. Basically, complications depend on the types of signs and symptoms you have. Like, for example, overly flexible joints can result in joint dislocations, and early onset arthritis or fragile skin may develop prominent scarring. People who have vascular Ehlers-Danlos syndrome are at risk of often fatal ruptures of major blood vessels. Some organs, such as the uterus and intestines, may also be ruptured, but this is also risky to pregnant women because pregnancy can increase the risk of a rupture in the uterus. Now, another complication is that these EDS can make or give a severe rupture not only in the blood vessels but of course to the reproductive organs of women. Now, how should EDS or how must EDS be prevented or be avoided? Well, aside from its cause that it is inherited from parent to child, there are also some genetic preventions that are formulated for this kind of syndrome. Now, if you have a personal family history of Ehlers-Danlos syndrome and you're thinking about starting a family, then you may benefit from talking to a genetic counselor or a healthcare professional trained to assess the risk of inherited disorders. Genetic counseling can help you understand the inheritance pattern of the type of Ehlers-Danlos syndrome that affects you and the risk it possesses for your children. Like, this prevention can only be done between a person who wishes to build a family and is from the bloodline carrying a genetic disorder, most especially the Ehlers-Danlos syndrome. Now, the life expectancy of a person who carrying this kind of disorder is that 48 years, and many will have a major event by the age of 40. So the lifespan of people with the scoliosis form is also decreased, largely due to the vascular involvement and the potential for restrictive lung disease. Now, we also have to understand what are the possible treatment to be done in this kind of disorder. Now, treatment is aimed at trying to protect the skin and the joints from further damage and to managing other symptoms which arise. For most people with EDS, generally speaking, number one treatment would be the physiotherapy can be very helpful to build strength and help balance as well as to provide support for joints by strengthening the muscles. Secondly, is that the talking therapy known as cognitive behavioral therapy or the CBT is often recommended for anyone living with a chronic condition that affects their life. Third is for patients with fragile skin, injuries should ideally be stitched by a plastic surgeon who understands EDS, and stitches should be left in twice as long as usual. Now, for the fourth treatment is that anti-inflammatory tablets and analgesics may be required to control the pain. And lastly, ascorbic acid is given or sometimes recommended to reduce bruising. Now, how is Ehlers-Danlos syndrome are inherited? Now, EDS can be inherited, but in some cases, it occurs by chance in someone without a family history of the condition. The two main ways EDS is inherited are the autosomal dominant inheritance, hypermobile, classical, and vascular EDS. The faulty gene that causes EDS is passed on by one parent, and there's a 50% risk of each of the children developing the condition. Now, second is the autosomal recessive inheritance is the faulty gene is inherited from both parents, and there's a 25% risk of each of their children developing the condition known as the Ehlers-Danlos syndrome. Now that I have discussed the prevention, the causes, and the possible treatment for EDS, now allow me to welcome my partner in this symposium, Marites Gazzingan, to present to us the 13 types or the 13 kinds of Ehlers-Danlos syndrome. Thank you so much, and let's welcome Marites a big round of virtual applause.
The 13 Ehlers-Danlos syndromes. The classification of EDS into different types has changed several times over the years. In 2017, there was a major change to the current classification. This divides EDS into 13 types. They are classified by what they are like to experience and to examine, and also by the gene changes that cause them. First is the hypermobile Ehlers-Danlos syndrome. This is the most common form of EDS. It is inherited, but so far no gene has been identified as the cause. It can be mild and is probably often undiagnosed. However, many people with hypermobile EDS have significant or even severe pain and disability. The main symptoms of hypermobile EDS are stretchy skin and unusually flexible joints. Second is the classical Ehlers-Danlos Syndrome. Classical EDS affects 1 in 20,000 to 50,000 people. It is autosomal dominant genetic condition, which means that if you inherit one affected gene, then you will have the condition. Classical EDS is similar to hypermobile EDS, but in addition, patients have very fragile skin which is prone to splitting, particularly over the forehead, elbows, knees, and chin. Those affected also have a tendency to form particularly thin scars. People also get rolled up skin around joints which can be easily injured, little mobile nodules under the skin, and easy bruising. Floppy muscles can be a feature, and children with classical EDS may be slow to stand and walk. Third is the classical-like Ehlers-Danlos Syndrome. This is also called tenascin X deficient Ehlers-Danlos Syndrome. This very rare condition is similar to classical EDS, except that affected people do not make wide scars. It is autosomal recessive, which means that in order to inherit it, you need to inherit one faulty gene from each of your parents. The other features of classical-like EDS, which are less common in other types of EDS, are long thin fingers, flat feet, swollen legs, nerve compression syndromes, diverticular disease, and wasting of the muscles in the hands and feet. Fourth is the vascular Ehlers-Danlos Syndrome. It is the most serious form of EDS. It affects about 1 in 50,000 to 200,000 people. Vascular EDS has autosomal dominant inheritance, so just one copy of the defective gene from either parent will cause the condition. A person may also be affected if there is a new mutation in the gene. And so, vascular EDS may occur in people with no history of the disorder in their family. The main risk to people's face is leaking or bursting of medium or large arteries. There is also a small risk of rupture of the large bowel and of the womb during labor, and of spontaneous pneumothorax. These are life-threatening effects which usually occur in young adulthood, making this an extremely difficult diagnosis to be given. Fifth is the cardiac valvular Ehlers-Danlos Syndrome. It causes problems with the heart valves in addition to another classical EDS-like symptoms. It is a rare condition, and in order to inherit it, you need to inherit one faulty gene from each of your parents. Sixth is the arthrochalasia Ehlers-Danlos Syndrome. It is a very rare, severe type of EDS in which the joints are very much looser than they should be. It has autosomal dominant inheritance, so just one copy of the defective gene from either parent will cause the condition. It is usually diagnosed soon after birth, as the babies are born with two dislocated hips. They also tend to have rather weak, floppy muscles and particularly stretchy, loose skin. Only around 30 cases have ever been described. Seventh is the dermatosparaxis Ehlers-Danlos Syndrome. Is an extremely rare type of EDS which has been described only around 10 times. Affected people have extremely fragile sagging skin. It is usually diagnosed before the age of 2 years. Fragility, bruising, and sagging of the skin are severe, but surprisingly, the skin heals as well. Like the other rare types, in order to inherit it, you need to inherit one faulty gene from each of your parents. 8 is the kyphoscoliotic Ehlers-Danlos Syndrome. This is a very rare type of EDS which has been described only around 60 times. Like the other rare types, in order to inherit kyphoscoliotic EDS, you need to inherit one faulty gene from each of your parents. Kyphoscoliotic EDS causes worsening of the curvature of the spine. 9 is the brittle cornea syndrome. This is a very rare type of EDS that the front coverings of the eye are thinner and less strong than usual, and the white of the eye may appear blue. Like the other rare types, in order to inherit it, you need to inherit one faulty gene from each of your parents. 10 is the spondylodiplastic Ehlers-Danlos Syndrome. It is one of the severe type of EDS. Like the other rare types, in order to inherit it, you need to inherit one faulty gene from each of your parents. Spondylodysplastic Ehlers-Danlos Syndrome is marked particularly by short stature and weak flabby muscles. Blowing of limbs is common. Unlike other types, there may be learning difficulties in children. Some of the features of EDS that affect eyes, bones, joints, blood vessels, or the lungs may be present, and there is a characteristic facial appearance. 11th is the musculocontractural Ehlers-Danlos Syndrome, which is a very rare type of EDS in which muscles in the legs and arms are severely tightened and shortened. These are called muscle contractures. The skin is severely affected too, being very stretchy, fragile, and easily bruised, with the atrophic scars seen in classical-like EDS. It can also affect bones, eyes, and the digestive system, and the kidneys. Like the other rare types, in order to inherit it, you need to inherit one faulty gene from each of your parents. 12 is the myopathic Ehlers-Danlos Syndrome. It is a milder subtype of EDS, which causes very floppy muscles, which may seem very poorly developed at birth, but which improve with age. It is possible to inherit myopathic EDS if just one of your parents is affected, although some versions of myopathic EDS seem to require you to inherit a faulty gene from the both parents. 13th is the periodontal Ehlers-Danlos Syndrome. It causes dental problems, particularly inflamed or absent gums, and poorly tooth development, on top of typical features of classical EDS. It is a very rare type but can be inherited from one parent only, as only one faulty gene is needed to develop the condition. What is the outlook for the Ehlers-Danlos syndromes? The outlook or prognosis is variable and depends on which type of EDS a person has. Most forms of EDS do not affect a person's lifespan, and people with milder symptoms are able to live their lives. However, the need to protect the skin and joints in those with more marked symptoms can limit a person's chosen activities, particularly those hoping to take part in activities with a risk physical injury, such as rugby, and can cause significant disability.